Welcome to the continued Spotlight on Education presented by Neosho County Community College. I'm your host, Huntyr Schwegman, and I'd like to thank you for tuning in today as we put a spotlight on the news, upcoming events, and academic programs at NCCC. In today's episode, we will be spotlighting the nursing program here at Neosho County Community College. And we're going to take a look at the program here during National Nurses Week. First up on today's episode, I have with me the director of the nursing program, Laura Mallett. So Laura, thanks for joining me today. It's nice to have you on.
Thanks for having me.
So Laura, before we get into some of these more intricate questions, just go ahead and tell us a little bit about yourself, maybe who you are, where'd you go to school, things like that.
I went to school here at Neosho County in the nursing program. I started with LPN, also graduated with an associate degree in business. Actually started to go to Emporia State and finish my prereqs for a law degree. And that didn't work, so I'm not a lawyer. So I came back and did my LPN certificate here, laid out for about 10 years and worked as an LPN, and then went back and got my bachelor's degree and master's degree at Pittsburgh State University. I'm also working on a master's degree in arts of religion, and I'm at Graceland University doing that right now.
You mentioned your story wasn't, one of the typical ones when you hear of a nurse getting into school and then going directly into the workforce. You mentioned a little bit of business in there. So what did kind of get you involved in nursing, and how did you decide to make that change from the business world to the allied health field?
Well, funny story. That was about the time Reagan was president and cut student funding for student loans and stuff. So I ended up coming home from Emporia State really not knowing what I was going to do. My mom was like, "You should apply to the nursing program. You'd be an excellent nurse." And I'm like, "No, I wouldn't, because I don't like the smell of hospitals and I'm not sure I want to take care of sick people." After much badgering, I went ahead and applied, got in. I was 10th on the waiting list. The day classes started, I was 2 hours late to class because they couldn't find me on campus, but I'm not a morning person, so I had classes at 10 o'clock in the morning, so I missed the first 2 hours of nursing class, so I started off behind, but it worked out.
I mentioned at the top of this segment that you are the director of the Mary Grimes School of Nursing. This is your first semester in that role after the retirement of Pam Kovault last year. So can you just kind of describe your role and some of the duties that you've taken on in this role?
I oversee the two programs. We have a program at Chanute here, and then we have a nursing program in Ottawa. We're working on doing a re-accreditation for the nursing program, and that comes up in February of next year. I do a lot of stuff within the state to keep the program up to date, current best practices in nursing education, mentoring with the faculty and mentoring with students to help them out, networking within the state to make sure that we have an excellent program.
So you mentioned the two campuses where we offer the nursing program, but there's also a few other things kind of mixed up in that. So why don't you take us through some of the specifics of the nursing program? Do students have to have any qualifications before they can be accepted? What kind of certifications or degrees are students working toward in the program? And what are some of the classes that students take?
Before application, they need to have A&P, General Psych, and English Comp 1. Then they apply for the program. They come to an informational meeting where we give them all kinds of information about the program, the cost of the program, what degrees they'll end up with, and kind of go there. And then they do an entrance test, which is a HESI entrance, that gives them an idea on their math and their reading and reading comprehension, because there's a lot of that in nursing school that they have to be able to do. In the first year, they can get an LPN certificate. Then they can sit for the NCLEX for the PN. They can work in their second year of nursing school as a licensed practical nurse, and then they work on the second year of the program is to finish up their RN, which will give them an associate degree in nursing. Some of our students also can come into the program that already have an LPN license and do an LPN to RN bridge course. That only takes a couple semesters to finish it, so they'll come in the summer and then finish that up in the last 2 semesters. We also have a program with KU and Pittsburgh State. KU's program, they have to get a lot of their prerequisites or all of their prerequisites out of the way. They can get their bachelor's degree here at home, don't have to leave home, it's all online. They graduate with us on Friday night and they walk at KU on Saturday with a bachelor's degree. And then Pittsburgh State, we have an agreement with them. They can do a jump start and do a couple classes their last couple semesters, get them jump started into that bachelor's degree. So we encourage all of them to eventually get a bachelor's degree, and some of the faculty will joke around with them, encourage them to get a master's degree so they can retire.
I think from the outside perspective, a lot of people that aren't in the healthcare industry kind of have a misunderstanding of maybe what the difference between a CNA and an LPN and an RN are. Can you maybe tell us the difference between what an actual nurse does as compared to maybe a CNA or CMA, and then talk a little bit about the differences between an LPN and an RN's responsibilities?
The CNA is a certified nursing assistant, so they'll do bathing, feeding, ambulation, dressing. That's about their roles. They can do vital signs and different things that way. You get to the licensed practical nurse. They are now IV certified after that first year, so they can start IVs, they can hang certain medications within the scope of practice. They do dressing changes, med passes, different mobility issues. They do follow-up assessments, whereas the RN will do initial assessments and develop a plan of care for the patient to reach optimal health.
Enrollment for summer and fall classes is now open at Neosho County Community College. Choose from over 40 programs like aircraft sheet metal assembly, nursing, automotive technology, occupational therapy assistant, surgical technology, welding, and many more. Whether you're looking to earn an associate's degree or break into a new career field with a certificate, NCCC offers something for everyone. Email advising@neosho.edu to start your academic journey at Neosho County Community College today. Now, can you maybe take us through some of the classes that students take that are specific to the nursing program here, and what kind of skills and techniques are taught within these classes?
So, like I mentioned earlier, they have A&P and General Psych and Comp 1, Comp 2, Developmental Psych, and Microbiology. That we recommend that they take before getting into the program. It's easier to schedule that way. If it doesn't work out, we can schedule around it and they can get those done. Then once they get into the program, they have patient-centered care 1 through 4. They have a pharmacology course. They have a pathophysiology course. They have professional nursing courses 1 and 2. Combine those a little bit. The patient-centered care courses are going to give them more of their skills for disease processes. And within that, there's practicum courses where they will learn the different skills in the lab, like catheterization, NG placement, vital signs, medications, injections, IV, how to insert an IV, how to take care of the IV, how to pull the IV out when it's done. Practicum 1 will do all their skills up front before they go to the hospital. There's an assessment course that they take, so they learn how to do a head-to-toe assessment and what the importance of that is. Along that, they learn documentation, communication, conflict resolution, how to teach the patients how to take care of themselves and stuff for health promotion, different risk factors and things that way.
So it really sounds like you guys are providing like a very wide base of skills for these nurses to learn, not just the healthcare stuff.
Yes, and we've also added VR, which is case studies of patients that they would take care of. So it gives them an opportunity to take care of patients that they may not see in the clinical area. Chanute, we're kind of limited to kind of critical access hospitals. Ottawa, we have a little broader range of clinicals that we go to, like Children's Mercy and some of the larger hospitals, so they get to see a little bit more. So that VR piece actually really helps them be able to see those cases, walk through them, and kind of be aware of them and kind of know what to do in an emergency situation.
Let's take a look now at modality. How are these classes set up? Are they in person, online? Is there some combination for a hybrid use? And what kind of opportunities are there for somebody who's maybe working full-time during the day?
If you're a full-time student coming into the program, they're going to be face-to-face, especially that first year of nursing school. Now, the second year for the LPN to RN completion program and for the RN level, they do have an option of going hybrid. Occasionally, some of like pathophysiology or pharmacology may be online, but it kind of just depends on who's teaching it on which campus of whether we have face-to-face. Most of the students really like pharmacology and patho to be face-to-face just because of the content and how heavy the course is. But every once in a while we do offer them online, but we do have that one section that's hybrid. For the students that work, most of them work because they have to have their insurance, health insurance maintained to be able to go to clinical. It's a clinical requirement. Most of them are working 30 to 32 hours a week. Some actually work more than that. They kind of just work their work schedule around the nursing schedule.
Taking a look now after graduation, once a student has their certificate or their associate degree in nursing, what kind of career opportunities do these students have? What kind of practices might students have the chance to work in?
Prior to graduation, they are working a lot of times as LPNs that are working that first year of school or working as CNAs or medical assistants. So they're working in clinical areas like doctor's offices, long-term care. A lot of them may be working in the hospital as a CNA there too. After graduation, a lot of them will stay in the area and work at the same facility. Every once in a while, they'll branch out and go to other areas, but they have opportunities in long-term care, acute care, med-surg, OB, pediatrics if there's a pediatric unit around. They also have ICU, ER, and a lot of them will go to those different specialized areas. Nursing is broad enough that if they go back to school, they could get into informatics for documentation, genetics, research. They can go into nursing education and actually work with students. So there's really no limit on the jobs that they can do. And I always tell them the good thing is they can get a job anywhere in the United States. If your spouse gets transferred, you get a job anywhere. It really doesn't matter with your nursing degree. If they're single, there's traveling nursing. A lot of them will do that for a little while and get experience and stuff. But we recommend that if they do traveling nursing, that they actually have some experience behind them because they're pretty much on their own when they go into those traveling positions. So there's an array of different things that you can get into. We used to tell them there's 57 jobs within the umbrella of the RN license. And that's whether you're an associate degree or a bachelor's degree. And with that, you don't have to go back to school to be able to figure out where your niche is in those 57 jobs.
I know you mentioned earlier in the segment that you do a lot of work to network with people at the state level and the regional level to make sure that the program here at Neosho County stays up to date and effective for students. Can you maybe take us through a little bit of specifics of what that might look like?
I would say the most recent would have been when we changed the curriculum. We had a nurse consultant come in. The nurses went to different CEUs on curriculum development. This is when we moved from the medical model to the nursing model, and that's what we teach now. We analyzed and evaluated what patients were seen in the ERs in the Kansas City area and in the Southeast Kansas area, and we chose our concepts and exemplars off of that information, and then we looked at the Missouri and Kansas mortality and morbidity rates to see what everybody was passing away from or what their comorbidities would be for disease processes and stuff. So we kind of look at that every year to update it, make sure that our terminology is what best practice is. Today, I'll be leaving for meetings in Topeka and networking with the associate degree programs in Kansas, their directors, and we all pull ideas together and take them back and see what will work with our programs.
So we're wrapping up your first semester here as the director of the program. I know you previously were the assistant director of the nursing program, but with you now at the head, do you have any upcoming plans for the program, or what does the future of the program look like here at Neosho County Community College?
We're looking at possibly assessing and evaluating a need for a paramedic to RN program. There's one or two in the state of Kansas at the present time, so we're kind of looking into that to see if it would be an option for paramedics to get their RN license and stuff. We're also looking at getting our numbers back up and maintaining our pass rate. We're at 85% right now, which is pretty good. We'd like to get those numbers up higher.
Laura, you're joining us on today's episode during National Nurses Week as we celebrate the work and the hard effort that you guys put into your job every single day. I want to know, how does the Mary Grimes School of Nursing celebrate National Nurses Week? And can you tell us a little bit about what it means to have a National Recognition Day for these students and for these nurses?
Based off of the surveys or the national surveys, nursing has maintained at the most trusted profession. The only year we didn't have it is 9/11 when firefighters and paramedics got it, which is understandable. So during National Nurses Week, we recognize the students. We welcome the students into the profession with little trinkets or cookies decorated as nurses and stuff that way, drawings and different things, gear that's marked with the nurses' celebration and stuff. Try to include faculty in on that as far as everything that they do to make the program successful. We do little things off and on, not only during Nurses Week, but during the school year. to help promote the nursing faculty too.
That concludes this week's episode of the Continued Spotlight on Education presented by Neosho County Community College. My name is Huntyr Schwegman, and I'd like to thank you all again for tuning in today. Don't forget to come back next week as we highlight another amazing aspect of Neosho County Community College, and visit neosho.edu for more information and to enroll at NCCC. Go Show!